Good afternoon. Housing is one of the most pressing and most personal topics that we'll be discussing today. I think all of us are well aware of the struggle to find affordable housing in this area. Statistics show that Maryland lacks 100,000 units of affordable housing. And in this time of a fair amount of uncertainty and turmoil on the federal level, that makes this issue all the more pressing. So let's begin today by discussing the roots of this shortage. How did we get here?
Yeah, I'll start if that's okay. Look, this is not a COVID phenomenon. Things got worse through the pandemic era, but the reality is this began post-2008. The financial crisis, a real estate-driven financial crisis, shouldn't surprise any of us that a reaction, one of the reactions from that was we stopped building. And we stopped building in a way that related naturally to the trend lines for replacing housing stock and for responding to population growth and demand. And the real problem is we simply never caught up. It never got better. And so now we're 16 years down the road, 17 years, down the road, and we simply haven't caught up. And so, like anything, and I don't want to pretend like housing is a simple commodity, but like anything, as demand rises and supply doesn't, price will increase. Some fundamentals of economics are true and still apply. So I think that's largely how we got here.
What are some effective...
If I may, I would go even further, with all due respect to the Secretary. I would go back to the origins of zoning over 100 years ago. I'm not saying that zoning is the only problem or the only reason for this, but it is one of the most substantial reasons. The phrase exclusionary zoning is redundant. Zoning at its core is exclusionary. It was designed specifically from Berkeley, California to New York City to exclude certain people from obtaining housing. The Berkeley Ordinance that was adopted, I think in 1917, something like that, specifically excluded, quote, Orientals from buying houses in Berkeley, California, that bastion of progressivity. So we would be arguing over and over again, zoning reform is fundamental to addressing the lack of housing.
And I would add to that, certainly agree with what Secretary Day has said, the root causes are, as well as Chuck. Zoning reform is critical for us to be able to build more and build faster. And in addition to that is improving processes, permitting processes, design review processes. They all take a long time, and that just doesn't allow us to build enough homes. I do want to say certainly, and it's hard to find consistent data or a singular source of data of how well we've done. So Novogradac data is that through 2023, Maryland's built almost 72,000 tax credit units. That's a lot of units, and the tax credit program has really helped fuel that. But it's not enough. That's over 37 years, and we need 100,000 more units. And basically, we need all levels of housing. It's not just affordable housing, but we need to build housing for all. And that includes having, middle-sized, larger developers, as well as what I call intermittent developers, be really part of the solution, because we need to do the infill. We need to do the 2, the 4-plexes, besides the 100, 200, 300 unit communities.
Curious what you would all say is currently working in terms of government interventions around this, and things that are not working. What needs to change?
Okay, all eyes on me, I see. Well, let me start off by saying, thank you, Chuck, for saying what you said about zoning reform. It is critical. And Janine, I think your point is right that we ought to be applauded for the capital A affordable housing that we have built as a state, but we need more housing, period. And what is working is that we're having a conversation right now about iteratively changing precisely what Chuck has identified, which is the regulatory landscape. But to carry the thought a little further on how we got here, Maryland is very different from certain other states and is unfortunately an unaffordable place to live. And that can be tied directly to the regulatory environment that we have created here. And this is not to lay this at the feet of any one level of government or any one person. This is true of something that is layered, multiple layers of government. There's a report coming out soon. I don't want to steal anyone's thunder, but you'll read the comptroller's report on this issue soon, and you can read the Maryland Department of Housing and Community Development's Housing Needs Assessment, which says, which these reports say, it is very clear that when compared to a state like Texas, and I'm not saying we want to be like Texas in lots of other ways, but on this, where 2/3 of the cost of constructing a home in Texas are the material and labor, the reality of building, the hard costs, and 1/3 is the carrying cost of the land, the regulatory costs, the time it takes, the fees that must be paid. In Maryland, it's the inverse. 2/3 of the cost of your house, of a house being built today, 2/3 of that are the process costs. And so to Janine's point about we need more lowercase a affordable housing, housing that any of us could afford or any person can afford at whatever their income level, we have to ask ourselves, when we create a regulatory process like that, what gets through? The answer is luxury housing. So when constituents are banging on their local government's door saying, why are you only allowing luxury housing and luxury apartments and McMansions to be built? The truth is, we've created an environment where the filter is set such that it's the only thing that can afford to get.
Yeah.
And what I would like to add to that, Secretary Day, as well,
I don't know that I
is that
answered the question. Sorry.
we talk a lot about supply, and we need supply, but it's a both supply and economic problem. And the economic problem deals with, obviously, construction costs, operating costs. They're high, but it's also the people within the state of Maryland. Wages have not kept up with rising rents, and inflation is much higher. At Enterprise, we own 13,000 units in the DMV. Most of our properties, about 8,000 units of those, are in Maryland. 46% of our residents are rent burdened. Many of our seniors have food insecurity, and Montgomery County did a council met this morning to talk about that. 36% of the households within the DMV have food insecurity. So it's an economic, from the people perspective, problem as well that we need to solve. Because supply, if we build housing that's unaffordable, isn't going to help. We need to address both.
Go ahead.
Oh, and then I would add to that, right, just like affordable housing, yes, and not just, thinking about vulnerable populations, but our entire population. I think one of the things that we've thought a lot about are ALICE populations, so just like working families and what that looks like. And so I think, kind of what that housing stock is. So the asset limited and like constrained folks who are already employed. And so these are people who are working as cashiers or working at our state health departments. And for them to be able to make a wage that's affordable to just survive is really hard, especially in these times when we know that other programs and kind of supports are being cut. And so what does that look like? And so that, I think from a health perspective for us, thinking about not just food security, but access to medications, transportation, all those different things that people need just to live.
I think one of the big conversations we have to have, and as a mayor and planner, and I've heard you speak on this when you came and spoke, it had been on the top of my mind, is are these decisions being made at the proper level of government? Local governments have had 75 years to address this, and they haven't. And so a couple of things are frustrating about that. The General Assembly has made some steps, but they're incremental, and they get watered down. Accessory dwelling units, The 2024 bill got watered down. I think we can agree. This year's bill got so watered down that I think you just said, don't bother, because it didn't resemble what was introduced by the administration. So the General Assembly has to step up if the counties aren't. These are big decisions and big discussions we have to have. And we're getting just a little bit frustrated, I have to tell you. We're realistic enough to know that these happen in incremental steps. But we're going to roll out a process that we're calling accelerated incrementalism. It's just not okay to take these baby steps. We're past this. We're in such a deep crisis. We need to do more and do it quicker.
And Chuck, can I just say, to your point about making these decisions at the right level of government, let's remember, Maryland has a proud legacy of at the state level deciding what should be established, what public policy objectives should be shaping where we can build. And what we've done as the smart growth leader state is tell people where not to build housing because it's inappropriate, because we have agricultural industry objectives, or we have ecologically sensitive areas we want to protect, or our Chesapeake Bay. What we have in front of us today is a public policy problem that is affecting every single family in this state, and I think it warrants a conversation about whether or not the state of Maryland can play the same role on the other side of the equation and be intellectually honest and finish the thought and say, also, let's incentivize building in the right places. And lastly, as a former mayor, I can tell you that we have set things up such that we defer to saying no. When the people who have the most power to decide what gets built and doesn't get built are the people who are going to get yelled at in the grocery store.
Exactly.
Trust me, I can tell you, by the people who say, I don't want anything to change in my neighborhood.
Right.
That piece of property that's been vacant at the end of the block will remain vacant because I said so, because I like it that way. And I'm not saying every argument is that simple. It's not. But oftentimes that is the shaping factor in what local decisions get made. And so we've set ourselves up for a dynamic where no is the default.
Yeah, and I think planning is not zoning. We need less zoning and more planning. And you know that.
I'd like to talk about the connections between health and housing. This is something that I saw firsthand a couple years ago. I wrote about a church in the Station North area, a Lutheran congregation that was formed by many people who had been unhoused or unstably housed. And I saw how hard the pastor and volunteers worked to get people into housing and how transformative housing was for people once they had an address, once they had a safe place to live. And I'm interested in talking about those connections, and I know, Maisha, this is something that Care First has done a lot of work with.
Yeah, no, definitely. And, I think we saw earlier this morning that housing came up a lot in a lot of the conversations along with health. And so I think one of the things that we know is that health is tied in a lot of different ways. And so for us, kind of from a health space, and other people may have heard it, but thinking about not just social determinants of health, but social drivers of health. And we know that housing is a social driver, so really thinking about the social and environmental factors that impact health. From the health space, we talk about 80% of your health outcomes actually are due to factors outside of the exam room. And so that is housing and access to food, access to employment and transportation. And those are the things that we really try to focus in on. And we also work, in the other 20% with providers. But, I think as a payer, it's really important for us to focus on all the other factors. People are part of families and communities. And, as we were talking about zoning, all communities do not look the same in Baltimore and across our state. And, thinking about life expectancy as well, that it, varies 25, 30 years, within 2 miles in Baltimore and then even in other areas of the state. And so everyone doesn't have the same opportunity. And what do we think about, how that relates to health? Kind of from a, cost perspective, we know that, people who are really vulnerable and don't have access to care often tend to utilize the emergency departments. And so how does that translate? It drives up health costs, and then you see it in your premiums. And so I think it's really in our interest as a payer to be able to make sure that people are really seen comprehensively, and we think about like whole person health. And so it's not just an individual at a point in time, but really what are all those things that people need to survive. And we know that, as you mentioned, with, in that Lutheran community, really being able to have housing and an address and how other things fall into place. And we see that with other things when other people have been housed. And so, if they have mental health needs, that those are being met. They also have different health conditions that are really contained and maintained when folks have housing. And so for us, we partner with organizations who are actually doing that work, but knowing that we can't do it alone. I mean, it's such a huge, multifaceted problem, and so kind of how can we partner with other organizations to really help make a difference?
I would add to that, and I'm so glad that we're talking about this topic, and that housing is healthcare, and housing supports health outcomes. It is the most high stakes, life and death game of musical chairs, and when there's not enough housing, the impact is people become unhoused. They lose that chair. There's simply no other outcome that it leads to. Homelessness is an economic condition, and requiring that people pass through certain gates or tests before housing will be afforded to them is the most illogical of requirements. And we know better. We know that providing wraparound services and making housing permanent for those who are not able to achieve it for themselves, permanent supportive housing, and providing the wraparound services, we know that it works. We know that it is a key to solving homelessness, and low barriers to entry into permanent supportive housing and other housing programs solves homelessness. But we're in a moment in this country, I think, where we're being asked to ignore data, to ignore evidence and the history of programs and what works, and to simply accept that somebody says the opposite is true. And it is the most, confounding, appalling, frustrating thing, I think, for many folks. And so what do we do about it? I think we run headlong into the opposition and say, but we know better. And so with our resources, we're going to do better. We're going to do it the way we know it works. That's why we put permanent supportive housing in the qualified allocation plan of LIHTC this year, using the resources we have. And it's why we have a homeless preference in the QAP as well. And why we're not done there. And I think we're seeing lots of innovation from local government. And look, there's going to be an attempt to starve us of resources coming out of Washington, but we've got to use what we can and what we have to hold on tight to the things that we know work, and not to give an inch when it comes to evidence-based policies and evidence-based programs.
And I'll add to that, as a developer and owner of housing, when we talk about setting aside funding for housing, we need to at the same time set aside funding for services. Our pro formas and the financials at the properties today do not generate enough revenue to pay for those services. And you're absolutely right, Secretary Day. There are proven programs out there. People are aging in place. They're reducing the cost of health plans by 50% if we can provide the services on site. And they're basic services, because people will make trade-offs. They won't go for their standard physicals, and they'll wait until they have to go to the emergency room, like Maisha said, which is way more expensive. So we have to think about it more holistically, and the funding has to come side by side to ensure that we can provide the right services and reduce the overall healthcare cost. And I'm always talking about healthcare needs to invest more in housing, and they have done so in some cases, but I'd like to see more of that, be part of the ecosystem that focuses on all the social determinants of health, and see housing as the platform for people to build healthy lives on and to build their well-being on.
And their generational wealth.
Yeah, no, I think, right, like, it's important for, help to kind of step in. And I think, one of the things that I've been able to be part of is a lot of funders collaboratives, so realizing that funders, whether it's corporate funding or other foundations, need to kind of come together and pool our resources. In no way can we really fill the gap that's, out there right now, but we can be part of the solution. And so thinking about what those investments may be.
I'd like to dig in a little bit deeper on something you mentioned, Secretary Day, in that these enormous changes we're seeing at the federal level, enormous amounts of uncertainty, how are they playing out in Maryland as relates to housing? What are you anticipating for the future? And what's being done to ensure that there will continue to be a good supply of housing here in Maryland?
I think we're in the fight of our lives. I really do. The number of fronts being opened changes every day. I have an executive team call every morning, and we've modified that to make it a federal update, litigation, policy changes, as well as our executive team call. And, every day there's a new assault. And so, that's threatening CDBG funding because Maryland DHCD has a significant non-procurement MBE program, because we have significant resources that go out into the community. And imagine if we didn't try to use those resources to reflect our values. Threatening our funding for homeless services in this state, $45 million at risk, because that money was going to be deployed in such a way as to provide for permanent supportive housing, and because housing first policies are the way Maryland has led, and increasingly has led over the last 2.5 years. Voucher programs, the voucher programs being at risk. Broadband, our broadband money was threatened. Look, there is no front, well, I shouldn't just say threatened, we also lost a nearly $50 million digital equity grant. Probably because Doge Googled, or did a search and found the word equity. I doubt they could even tell you what was in the grant, and took it away from our state, as well as many others. So last week I met in New Orleans with my peers, the other HFA executives from around the country, Housing Finance Agency executives from around the country. And what we learned is red states and blue states are being treated differently. This is a war. This is unprecedented. This is violence being visited upon our state, and I don't use that term lightly, in a way that we haven't seen in my lifetime and probably in most of yours. So I think, once again, part of the answer is we do the most with what we can control. One of the things that, going back to Chuck's points, one of the things that we did in 2024 when we started framing how we were going to address this problem was to say, look, there are macroeconomic factors. You're so right, Janine. The cost of money, so finance. There's the cost of plywood, and all the power embodied in a state government and in a governor. And I don't think he can influence the price of lumber. Not much lumber. And so there are things beyond our control, including coming out of Washington. But there are so many things within our control. All of the zoning factors, permitting process factors, all of those things called out in the governor's Housing Starts Here executive order that he signed last month, that addresses not only local government's responsibilities, but also state government's responsibility to be efficient, effective, and fast with our permitting. All of those things are well within our control, and frankly, are the most influential factor to what differentiates the price of a house in Maryland versus the price of a house in Virginia, or the price of a house in Maryland versus the price of a house in southern Pennsylvania. And so we've got to tackle those things that we can control, and we've got to stay true to our values. Like when the governor, or when the General Assembly signed the Just Communities Act, or passed the Just Communities Act, and the governor signed it, and when the governor signed the Just Communities Executive Order last year, allowing us to use directing us to use $400 million of state money to focus on areas that had been damaged by the very intentional acts of government, redlining and collusion of government and finance, redlining, zoning, et cetera, urban renewal. Those are our values turned into policy. If we turn our backs on that now, just because we'll curry favor or maybe be harmed less by Washington, I guarantee you we won't get this moment back. So we have to be true to ourselves now, and we have to control what we can control.
Yeah, real quick, I think that opens up a whole other, we don't have that kind of time, but government has been implicit. Realtors have been complicit in this. We acknowledge that. We did the redlining, we did the blockbusting, and we've owned up to that. Government has done more than its share. Here, the Black Butterfly in Baltimore, if you're not familiar with it, pick up that book. Government policies created a lot of this problem, and government policies have to be key to fixing it.
Yeah, and I would add what we can do as well in Maryland is that certainly the increase in the low-income housing tax credit program is a positive. The 25% test is, but how we implement it will make a difference. So let's be smart about how we do that, and for it to help us actually preserve as well as build new. And then secondly, and this is certainly thank you to the governor, is how do we create more clean energy funding? Maybe Constellation, who was here earlier, would like to put a fund together for affordable housing. But we are proving that we can actually create investments. At Enterprise, we thankfully for the governor moving some funds from MEA to replace Solar for All funding that was lost. We are going to be closing on a clean energy business portfolio that's going to touch 25 of our Maryland properties. And when we did that in the last 2 years, 3 years at 13 other properties, our residents at those 13 properties have already seen $230,000 in reduced utility costs. So it works. So if we can find some more money for that, we can, with rising utility costs in Maryland, which are going to be pretty high over the next few years, it's really going to help the Marylanders that live here, and it's an investment that has a return of $3 to every dollar invested.
I think there was a banner headline the other day that said Maryland's budget outlook doesn't look as bad as it did before. It was something really, really, there was definitely some silver lining thread in there. But yeah, I think this idea of being creative with the limited resources we have is well taken, and I hear you loud and clear on the deployment of LIHTC resources in the year ahead.
I know we have some questions from the audience too, and my colleague Tennyson Danye is going to be helping us with those.
All right, let's jump into it. Our first question is, if you had a magic wand, what thing would you change to help create the most housing today?
One thing? I have 4. Very quickly. Janine mentioned middle housing and single-family zones. Middle housing, duplexes, triplexes, small apartment complexes. I live in 10 minutes from here in Mount Washington, and within 5 blocks we have all of that. And guess what? We live happily together. I see signs in parts of the state, no apartments, no compromise. I want to tell you what I really think about that. Accessory dwelling units. We got a bill. It took 3 years. It's going to take another year for local governments to enact their ordinances. Accessory dwelling units, sorry. And they should be allowed as of right. We have private property rights. That's one of the things that we absolutely focus on. We need more adaptive reuse, taking unused commercial spaces, like Lutherville Station was a terrific example, and it's been zoned almost out of existence. And we think that should be compensable. If a county downzones to the extent where it almost has no economic viability, that developer should be compensated for it. I have a lot more, but that's enough.
I would add more public-private partnerships to build mixed-income communities, because, again, we need to build housing for all. and make sure that we target all the different income levels.
And I'd love to see kind of like the built environment look different. And so kind of adding to what my fellow panelists said, so really thinking about just building communities in which there's like parks and, lots of, access to community gardens and just like really rethinking our environment, and which is happening in some neighborhoods, but kind of what does that look like and that just be the norm? That would be amazing.
I just want to be fortunate enough to help implement the things they wished for.
All right, so our next question is, what more can be done to support people with disabilities as it relates to this issue and finding affordable housing?
The analogy that I used earlier, the life and death game of musical chairs, the reality is the people who don't get that last chair are the most vulnerable. And often it's persons with disabilities. We find that the vast majority of people who are in need of permanent supportive housing, are very deeply income constrained, have a disability. And so I think part of the answer, I think the answer, frankly, is that we should put our resources into permanent supportive housing. I think as a state, we will find that we spend less on emergency departments, we spend less on insurance, we spend less on our jails and prisons, we'll spend less on law enforcement, because those are the poorly designed mechanisms for addressing homelessness that we use today. And look, the legal context has gotten worse. The federal government has made some decisions. The Supreme Court's made some decisions I disagree with, and in criminalizing homelessness. But I am confident that we don't have to follow that same course. And in this state, we can show that the cheapest way to address the problem is the most humane way, which is to provide services, pay for services, and at the very front of it, provide someone with housing and a guarantee for that.
And I would add to that, simplify the process and the systems. This is not here in Maryland, but I have actually experienced where the referring agency was asking a homeless person for a legal address to verify their residency, or otherwise they could not get through the process. So we have some really weird regulatory requirements that are barriers, and we need to remove them. And then secondly, I would say holistically look at making sure we have the right resources in place in the right agencies as well. We have project-based units sitting vacant because there's not enough resources to keep up with the waiting list. So you have stale waiting lists, and people have to wait until you go through a process. Again, that's pretty lengthy and complex, and that's just unacceptable. We should not have any project-based voucher units sitting vacant.
All right, and one last question. What innovative solutions, national and local, whether here or elsewhere, are showing promise?
Unfortunately, Maryland, for all its purported progressivity, is woefully behind a lot of parts of the country. The Secretary knows this. Houston, Texas is a vibrant city. They don't have zoning. They have planning. Oregon, a lot of cities and states have addressed these issues in ways that we've already discussed. Zoning reform, accelerated, securing of zoning rights, manufactured housing. There are lists and lists of innovative solutions that are actually being tried and successfully in other parts of the country. And Maryland has not been able to catch up. Those are just a couple of, I know you have several others.
I'll just offer two examples that really go right in line with what Chuck's saying. Number one is the Vermont Housing for All Toolkit.
Yep.
The Vermont Toolkit, and there's a recent adopted one in Cape Cod, multiple jurisdictions in Cape Cod, Massachusetts, and then the cities of South Bend, Indiana, and Kalamazoo, Michigan. And what these toolkits do, and what the Vermont toolkit does in particular, is it designs a set of pre-approved plans that jurisdictions can, that an architect, a builder, developer can simply submit, and these are pre-approved. So the permitting process goes from a long, cumbersome, one-off process to real quick. You can imagine in a city with 20,000 vacant lots, for example, if you could imagine such a city, that a pre-designed, pre-approved solution that drew on the architectural aesthetic of the homes in that place and that consumers wanted, which, by the way, ask live Baltimore, there is high demand in the city for housing, and when we build new or renovate fresh homes, people want them.
Yeah.
People want to live in Baltimore. And so, you could imagine, though, a modular solution also that was designed with that architectural aesthetic that was attractive and honors Baltimore's legacy,
Yes.
and was easy to execute and required really no regulatory process, no review, and was simple to execute on. There are some complexities, not surprisingly. The other is I'll offer the Texas model. I know we've talked a lot about Texas here. I'm sorry. We're not Texas. We don't want to be Texas. We have a better flag. But Texas adopted a starter home legislative package, which just allows for the use and development of many smaller lots, particularly infill lots in urban areas that are going undeveloped right now for no real good reason, and ultimately also allows for a smaller product, and that's key. We got limited land, zoned appropriately, as long as zoning exists.
Exactly.
We've got, and the need for smaller products, smaller square footage means that you've got a more affordable product. So I think Maryland should adopt legislation just like that.
We're with you.
I could listen to all of you talk all evening, but unfortunately we are out of time. I am so grateful to all of you. I think this was a really fascinating discussion. Thank you so much for your time today, and thank you to the audience.
Thank you.
Thank you all.